between heat exhaustion and heat stroke?
Tal, before we even get into it, I want to tell you about a scenario. I went to a college graduation approximately 1 month ago for a family that I've been taking care of for over 20 years. The young lady that graduated from college had everybody there, most of them my patients, except for her father. And I remembered her father lost his life to a heat stroke about 8 years ago. He worked as a construction worker, but after he lost his life, the construction plant put a new policy in place where if somebody is exhibiting symptoms of a heat injury, such as heat exhaustion, which usually precedes heat strokes, they have a protocol where you can go into an air-conditioned trailer, be hydrated, and observed for 1 hour before being allowed to get in your car and drive home. To encourage people to follow this new policy, they would compensate them with pay for the entire day. And since they implemented this policy, I've learned that no one else had a heat stroke on their job. So by it being so hot, I think this is the most appropriate topic to distinguish between heat exhaustion and heat stroke and what we can do to protect ourselves.
Absolutely. So tell us, are there any specific groups of people that are more susceptible to heat stroke?
Most definitely. Those that are elderly and also very young toddlers or even babies, because they can get hot a lot faster than a younger person, maybe in their 20s or 30s. And also people that have chronic medical conditions like chronic kidney disease or diabetes or heart failure on a lot of different medicines, such as diuretics, that won't allow the blood vessels under the skin to dilate so that we can sweat properly, which cools us down. Also, we want to look at the difference. Now, heat exhaustion, as I said, usually precedes heat stroke. And when a person is having heat exhaustion, they're normally sweating profusely. They can become very dizzy or faint. They'll have cool, pale skin, sometimes nausea or rapid heart rate. And we have to be careful because this could lead to heat stroke, which could take their life. In a lot of cases, these people with heat exhaustion can have muscle cramps. But if they develop heat stroke, which is a medical emergency, what happens is the central nervous system just shuts down. They can't sweat anymore. So their skin will be very dry and hot. And usually, in a lot of cases, they'll lose consciousness. So we have to call 911, but we need to intervene when they're in heat exhaustion while they're still sweating. Because if we get them to a cool place, get them hydrated, just relax, usually we can save their life.
Where like clothing to spray them with a tube-on. Especially if you're trying to get outside, actually, but